Hello, my name is Lara and I am a vaccinator and an administrator for the COVID vaccination programme, and I'm also the student ambassador for the COVID vaccination programme in Northamptonshire. So my journey started in January 2021 in the NHS by being an administrator. I'm currently at sixth form studying A-levels. I'm studying psychology, applied science and health and social care. And in January 2021, we were in the middle of a lockdown, so all the schools were closed, so I didn't have much to do. So I thought coming here in my spare time would be something that I could do to help our community. When I started here, I was an administrator, so this role entailed being in several different places around the centre. So what I could be doing one day would be different from the next. I would stand at the front door, I would welcome patients in, and I would take their details, which is usually their date of birth and their NHS number. So it all goes onto our system, so when they head through to be vaccinated, the details were already there for them. But I would also work in the vaccination bays themselves, where we would welcome the patient in and I would make sure all the details on our system were correct so they could be vaccinated and it would all be a safe process. I have learned an enormous amount being an administrator. I've learned how to work with different age ranges, I've learned how to work with different groups of people with learning disabilities, people who may be anxious and worried. I've also learned how to work with people who don't have mental capacity. I think the experience of working with all of these different people have given me lots of different opportunities to decide what I want to do with the rest of my life. So I want to be a nurse, and I'm going to university in September to study nursing. But whilst working here, I've figured out that I want to do more than just adult nursing, that maybe I want to go into mental health nursing or learning disability nursing, and that is all because the experience I've had sat in the chair just speaking to patients. Being an administrator means I get the opportunity to work with lots of different medical professionals as well. So I work with doctors, I work with nurses, healthcare assistants, pharmacists and a whole range more. And I think being able to hear different perspectives of like the healthcare environment from different professionals has really broadened the way I think about the healthcare system and the NHS. I'm going to try and sum up my day here at Moulton Park Vaccination Centre so you can get a bit of an insight to what I do on a daily basis. When I work a morning shift, I tend to wake up about 6 o'clock in the morning and leave the house at about 25 to 7. It takes me about half an hour to get to work if the traffic's not too busy, so then I'm definitely going to be there on time for my 7:30 start. I did treat myself to Greggs this morning as I was running early. When I arrive at work in the mornings, I go through the staff door and I tend to be greeted by one of the security guards who are there to make sure that only people who are allowed in the building come into the building. When I get into the staff area, the first thing I do is get my locker key, swipe card and sign in. Before every shift, the clinical lead and the ops manager always run a huddle, and in the huddle we speak about different dates for vaccines, what vaccine we'll be using and who we're expecting that day, so how many appointments. We also speak about any problems that we've had and anything that we should be careful of so we can improve our practice. The huddle is also a great opportunity to see who you're working with that day, so you can all say hello to each other and make sure that everyone knows each other. And if you don't know somebody on the shift, that's the chance where you can go meet them. After the huddle, and once I know where I'm going, I head downstairs and I go into all the pods to make sure they're clean and tidy and ready for the day. This pod here is a pod that we use to vaccinate our 5 to 11-year-olds. The clinic wasn't actually open for them this morning, it opened at 12 o'clock when I left. But this is where we do it, and as you can see, it's very fun and colourful, and all of the team have worked really hard to liven the place up. All of the children absolutely love all of the paintings, and we also do have lots of toys and distraction techniques so they feel comfortable and at ease when coming to get their vaccine. This is one of our general pods, so anybody can come through this side. So when we have our paediatric clinic, so our 12 to 16-year-olds, we do like to keep them separate from pod A and we use this side. But if we're running on quite busy numbers, then we will open this side up to adults and run adults through both pod A and pod B. For a day when I'm doing admin, I'll go into the pharmacy and make sure that I have all the correct paperwork, and then I log into the system. Here you can see me writing out lots and lots of vaccination cards ready so I can put patients' names straight onto them as soon as they come in. So hopefully that gave you a bit of an insight to daily life here the vaccination centre. Obviously it's a bit difficult to film, especially when there's patients about, but that's kind of my day when I do admin. I haven't been booked in for a vaccination shift today, so I didn't do any vaccinating, but yeah. No day here at the vaccination centre is the same. So sometimes I will come into work and I'll be administrating, next day I'll come in and I'll be a vaccinator, the day after I could be in the waiting area, I could be flow coordinator, I could be helping outside. And I just love that I get the opportunity to do so many different roles, because again, it helps me meet new people and experience new things and learn new skills. When I went for my university interviews a few months ago, I got so much support from all of my colleagues, and they all helped me prepare for my interviews and they helped me understand the real world of nursing. So I was able to go into my interviews and answer the questions in the way that I knew they wanted me to answer the questions in, but also the experience that I've gained here has helped me answer the questions. Like, there's been lots of questions that I was asked that were about situations and how would I manage a certain patient in a certain situation, and due to all the social skills that I've learnt here and the different ways I can communicate, I was able to confidently answer all of the questions. I thought it would be nice to pop in this video some pictures and videos of just little memories that I've made at work. Like, I have met so many new people and made so many new friends, like working with the NHS, and they've all been from different organisations as well. So NGH, KGH, NHFT. I've met people who volunteer for St John Ambulance for the Royal Voluntary Service. I've met people who have joined up just like me, who haven't had an NHS pass, and I still am in contact with them all now, and I just think it's such an amazing community that we have. Thank you so much for taking the time to listen to my personal story and to listen to how joining the NHS and being a part of the vaccination programme has made a massive impact on my life.